How can you tell if your asthma inhaler is truly empty? Imagine reaching for your inhaler during a sudden asthma flare-up and wondering if it will work. Knowing if your inhaler is truly empty can be tricky but is very important. Many inhalers, especially pressurized metered dose inhalers, use a propellant gas to push out the medication. This gas can stay in the canister even after all the medicine is gone, making it hard to tell if you are getting a dose or just gas. Most inhalers do not have a clear indicator of when they are empty. Shaking the inhaler or listening for a sound is not reliable because the gas can still make noise or spray even when no medication remains. You cannot taste the difference between the propellant and the medicine either. So, these methods are not very helpful. One common trick people try is the float test. They remove the metal canister from its plastic holder and place it in water. If it sinks or floats with the top down, it is usually full. If it floats horizontally, it might be empty. But this test is not very accurate and can even damage the inhaler or affect how it works. It is not recommended by health professionals. The most dependable way to know if your inhaler is empty is to keep track of how many doses you have used. Each inhaler has a label showing the total number of puffs or doses it contains. By marking each use, you can estimate when it will run out. This method works well for preventer inhalers used daily. For rescue inhalers used as needed, keeping a careful count is more difficult but still possible. Some newer inhalers come with a dose counter that shows how many puffs are left. While helpful, these counters are not always perfectly accurate. People sometimes forget to check them or accidentally use more doses than the counter indicates. Even with a dose counter, it is wise to be cautious. Another way to check is by weighing the inhaler. A full inhaler weighs more than an empty one. For example, a full Salamol inhaler weighs about 26 grams, while an empty one weighs around 17 grams. A full Ventolin inhaler weighs about 37 grams, and an empty one weighs about 25 grams. Using a kitchen scale can help, but you need to know the specific weights for your inhaler type. Because it can be hard to tell when an inhaler is truly empty, always keep a backup inhaler nearby. This is especially important for rescue inhalers used during asthma attacks. Having inhalers in different locations like home, work, or school can help, but it makes tracking doses more important. Many people, including children and their families, are unaware of how to tell if their inhaler is empty. Patient leaflets often do not give clear guidance on this. Talking with your healthcare provider about your inhaler use and how to track doses can help you stay prepared. Remember, there is no foolproof way to see if your inhaler is empty just by looking or listening. The best methods are to keep a record of your doses, use inhalers with dose counters when possible, and weigh the inhaler if you know the expected weights. Always have a backup inhaler ready, and check with your healthcare provider if you are unsure. Proper inhaler technique and regular check-ins with your asthma care team can help make sure you are never caught without medication when you need it most.